This segment of the Safe Injection Practices Review addresses the techniques important in safe intramuscular and subcutaneous vaccine administration. First, let's focus on intramuscular injection. Previous segments have addressed how to prepare the vaccine for injection, ensuring that it is administered to the right patient using the right route, giving the right dose at the right time, and using the right techniques are all critical elements in safe injection practice. For intramuscular injection, identify the landmarks so the vaccine is administered into the belly of the deltoid muscle in the patient older than the age of 2. Under the age of 2, the preferred injection site is in the leg. Disinfect the skin, then insert the needle at a 90-degree angle, making sure you are using the correct needle length for the patient. For smaller patients, you can pinch the area, grasping the deltoid muscle as you prepare to insert the needle. For most patients, use the press and spread method to minimize the amount of tissue between the skin and the muscle. This enables you to use a 1 or 1.5 inch needle to reach the deltoid muscle. Aspirate to ensure that your needle tip is not in a vein. Then inject the vaccine. Remove the needle once the vaccine has been administered and quickly activate the needle's safety device. Have a 2x2 or alcohol swab readily available to cover the site and massage it gently as you prepare to cover the site with a Band-Aid. Talk with the patient about movement of the arm and performing a periodic gentle massage. For a subcutaneous injection, grasp the fleshy part of the outer aspect of the upper arm. Disinfect the skin, then insert the 25 gauge 5/8 of an inch needle at a 45-degree angle. The tip should be deep in the subcutaneous tissue and not the muscle. No need to aspirate prior to injection, as it is unlikely that the tip of the needle will be in a vein in the subcutaneous tissue. Once the vaccine has been injected, quickly remove the needle and activate the safety device. Have a 2x2 or alcohol swab readily available to cover the site. Cover with a Band-Aid. Always dispose of your used needle and syringe immediately after use. Vials made of glass can break in the trash, so add those to the sharps container too. Talk with your patient during the injection process and share information about the vaccine. Use distraction techniques to keep them from holding their breath or bearing down. That may prevent hypotension and fainting. Observe them and be prepared to intervene if necessary. Talk with them about any follow-up or next doses of vaccine and make sure they receive a copy of the VIS before the vaccine is administered. Clean your hands again when done. So, let's talk about our take-home points. First, begin with clean hands. Make sure you know your anatomic landmarks and can see them before you attempt injection. Disinfect the skin with a sterile alcohol swab. For intramuscular vaccination, make sure you have an appropriate needle length and are using a muscle grasp or a spread technique so you can administer the vaccine into the muscle and not in the subcutaneous tissue. Enter the arm at a 90-degree angle. For subcutaneous vaccination, use a smaller needle and enter the tissue at a 45-degree angle. Activate your safety device as soon as possible after removing the needle from the patient. Promptly put used items in a readily available sharps container. Again, clean your hands when finished. Thanks for your attention during this segment of Safe Injection Practices. I hope that you'll take the time to look at the next segment.